So I decided to go full on with the shirts today. So this is the famous Nok-U shirt. Nok-U meaning baby owl in Thai language. At least that's what my niece calls it. So there you go. You've had a Thai language lesson before we get stuck into the hard stuff. And this psychoed lecture really is what I deliver in inpatient treatment settings for new clients who are just coming through detox, etc. And I've been doing this for about 15 years. And it receives near universal approval, actually. There are very, very few people, in my experience, that don't identify with this explanation of addiction. So here goes. So the best place to start, if I was going to ask you the question, what is addiction? There would be various answers depending on the time, the place, the person. If we were asking older generations, or if we were asking that question on the street in more conservative countries, it might be something like it's a moral failing, it's weakness, it's a lack of willpower, that sort of old-fashioned argument. If it were younger people, perhaps people in trendy urban centres of Western countries, it would be probably is childhood trauma, something like that. This explanation I'm going to give is kind of in the middle. It's much more biologically oriented. So in 2011, I think it was, ASAM, the American Society of Addiction Medicine, issued a definition of addiction, which, to paraphrase it, went something like: addiction is a primary, chronic and progressive brain illness affecting reward, motivation, memory and related circuitry. So related circuitry would be things like impulse control, learning, those kinds of brain functions. And what that points us to pretty quickly is the neurotransmitter dopamine, which is heavily implicated in all addictions. So one of the common misnomers, if you like, that people tend to get about different drugs that are abused and become addictive is that only some of them strongly upregulate dopamine. That would be amphetamines, cocaine, nicotine, caffeine. And the other drugs like heroin and alcohol tend to work on other neurotransmitter systems like the endorphin system, or benzodiazepines that work on noradrenaline and other neurotransmitters. But it's important to point out from the beginning, we've had the neuroscience for 20, 30 years that proves that all drugs of abuse, anything that is abusable or likely to be used for its rewarding and pleasurable feelings that it produces, will raise brain dopamine. It will raise dopamine at the nucleus accumbens, part of the midbrain. So there are numerous neuroscientists and researchers. Two Italian researchers in the late 80s were the first ones to get onto it. I forget their names, Imperato or somebody like that, 1988. In the 90s, you had neuroscientists like Ken Bloom isolating the brain's DRD2 dopamine receptor gene, a polymorphism that they found in that gene that was strongly linked to alcoholism. And the press got very carried away and described it as the gene for addiction, which of course it isn't. What we're probably looking at in terms of genes with regard to addiction is a multi-gene disorder. And when I say multiple genes, that's possibly in the hundreds. So if you think that a lot of illnesses are single gene disorders, they're quite easy to understand. Addiction is not that kind of illness. It is extremely difficult to understand. And I think they literally call it, neuroscientists literally refer to the brain, for example, as a hard organ. It's a hard organ to study, right? So you've got a multiple gene disorder, potentially, in the brain, which is the most sophisticated instrument in the known universe, right? So this is not an easy illness to understand. And we can get into the controversy around the word illness in another video. So perhaps I'll call it a disorder for this video. Let's just call it a disorder so it doesn't have the loaded nature of the word illness or disease. So this disorder is very, very complex potentially, and I would see it as a brain-based behavioral disorder that is strongly driven by the brain's dopamine system. So, and also it's worth mentioning, National Institute on Drug Abuse, researchers like neurobiology have been pounding on for decades that dopamine really is the common denominator behind anything that becomes compulsive and obsessive, in other words, addictive, right? So all drugs that are abused will upregulate brain dopamine in some way, and that is what's relevant to the addiction, not the fact that they also raise endorphins or serotonin or this or that, other neurotransmitter systems. We're focused on the dopamine system. So when ASAM said that addiction is a primary, chronic and progressive brain illness, let's break those three words down. So a primary illness is one that just exists already. So if you think about it, the psychiatric model, as you'll often hear it, often I'll get clients who are in treatment and they'll say things like, I abuse cocaine because I'm ADHD. I drink alcohol because I'm depressed. And where they get that from, usually, is their doctor. So a psychiatrist, usually, or a psychologist has said, you drink because you're depressed. And in some ways, well, yeah. But what that's saying is that addiction is a secondary illness. Then the primary illness is ADHD or depression. And that's not what I see. That's not what we see. What we see is an independent illness that we currently call addiction. That's a terrible word for it, because addiction just describes drug using. And actually this illness has got nothing to do with drug using. Okay? Shooting up heroin in your arm with a needle is not what this illness looks like. What this illness looks like is how you look when you're not using drugs. That's the illness. That's the primary illness. And the argument goes that that existed before you started using, that in fact that is the reason why you use, and then of course when you cease using, when you stop, the illness returns, because it's a primary illness that's related to poor dopamine function, and we'll get into that. So the second word, chronic, obviously most people know a chronic illness is one that cannot be cured, is incurable, or at the very least the symptoms will linger horribly. And the only way that you can deal with chronic illnesses, this sounds like really bad news, I'll explain by the end of the video why it's really not that bad, okay? But chronic illnesses must be treated. They can't be cured. They require ongoing treatment, and if you treat them well, then the symptoms will go into remission. And addiction is such an illness. That's exactly how addiction works. The treatment happens to be behavioral because it's a predominantly behavioral illness. So the treatment will not be medicines, it will not be pharmacology, it will not be drugs that treat you, not medicines. It will be behaviors that treat you, that end up being an effective treatment. But if you stop doing those things, the symptoms of the illness will overpower you again. Okay, so let's think of addiction as a chronic disorder. It's not curable. So then the last of those three words, progressive, that means it gets worse over time. Now I'm going to suggest that addiction gets worse over time even if you're sober, which sounds crazy and counterintuitive and stupid. But what I mean exactly is, without treatment, without doing the correct behaviors that will heal you, then it doesn't matter if you're not using your drug. You'll continue to get more ill, and that will mostly manifest in terms of mood and behaviors. You'll often hear it described as dry drunk or untreated alcoholism. That's exactly how it is in my experience. So the reason that all of these really odd, counterintuitive sounding things can be true is that it is an illness that's got actually nothing to do with drug use. The addictive, compulsive, obsessive use of drugs is like the middle part of the illness. That's the active part. Before and after, there is a kind of mood disorder that's very specific and unique and looks quite different to anxiety or depression or PTSD or ADHD. It's quite distinct. And these symptoms might be something like this: restless, irritable, discontented. Where have we heard those words before? You'll hear those words in the basic texts of 12-step fellowships, which are voluntary support groups run by peers to help each other overcome their addictions. And they describe their untreated illness in that way. And those things sound to me a lot like the symptoms of poor midbrain dopamine tone or poor dopamine function. So now we have to have a quick foray into what dopamine is, at least in the context of addiction. So a lot of people think of dopamine as a pleasure chemical. That's not the way I was taught. What I was taught is that it's a reward chemical. Now, reward is a very different thing to pleasure. So if you think about that, here's an analogy. If you ask a nurse or any helping professional why they do what they do, they'll probably say something like, it's rewarding. Now, cleaning out people's bedpans is not fun. Okay, so what do they mean? They mean that it has meaning, their job has meaning, and even though it's hard and tough, they enjoy it. So we can understand then that some things that are rewarding are not pleasurable. Well, in a different kind of a way, in a nastier kind of way, that describes addiction as well. Most end-stage addicts, most veteran addicts who are really at the end of the line with their using, they are not enjoying it anymore, clearly, and yet they still cannot stop. So if you think about it that way, that they're chasing a reward rather than a pleasure, that makes sense. It explains why addicts continue to do the crazy things that they do, even though they don't like it anymore. Yeah. So they want the drug, but they don't like it. So if you look at models of dopamine function like incentive salience, which is Kent Berridge's model of how dopamine works, dopamine is more a brain chemical that is designed to motivate us towards finding things that are of the highest importance. So it's not motivating us to seek pleasure, it's motivating us to either seek things that are important or recognize important things when we find them, or just simply chase what we have decided is important. Okay, so addiction is about wanting more than it's about liking. It's about the desire to acquire. That's the way I phrase it. It's a desire drug and a desire neurochemical. And if you think about it, desire, again, is a state of being that is not necessarily pleasurable. You can have somebody who's completely obsessed with a partner. Maybe, to use a horrible analogy, they've been stalking their partner. They've had an injunction taken out on them. And you ask them why they're doing it. It's not pleasure. They know they're doing something wrong. They're full of shame, but it's an obsession. They can't stop. And what's driving that is desire. It's not pleasure. Okay, so that's the kind of thing that dopamine is. How did it evolve? Well, obviously it evolved to help us get the things we want and need for our survival. I think I'm right in saying that even single-celled organisms have some kind of basic dopamine neuroanatomy. Okay, so it helps you move forward and get the stuff you need, which obviously in the ancestral environment is mostly food and sex and shelter. But even, for example, if you were to drop your keys on the floor, it would be dopamine that helped you pick them up, because you would recognize that the keys are important for your functioning and it would motivate you to pick them up. So that's what dopamine is doing, and that's what neuroscientists think is going wrong with addiction. So now let's imagine a scenario where some people were born with poor neuroanatomy. Dopamine neuroanatomy, as I understand it, is quite fragile anyway. So if you were born with slightly compromised dopamine or reward function, salience function, you would not be able to work out what was important in the world. You wouldn't feel very motivated, and you wouldn't feel rewarded when potentially rewarding things happen. So imagine your cousins or your brother or your friends, your children, and they're playing chess or walking the dog or something. They're just sucking up a lot of reward out of that experience. You, as a dopamine challenged person, if you like, would probably not be sucking up as much reward or meaning feelings out of those experiences. So imagine that as a basic theory, that you were just not very talented at feeling motivated, rewarded, seeing the meaning in things in the way that other people were. In other words, you had poor dopamine function. Now, how could that happen? Well, if you read addiction doctors like Howard Wetzman is a great guy to read on this. He explains the dopaminergic roots of addiction really, really well. Also read the neuroscientists like Ken Bloom and Mark Gold as well. They will explain that there are potentially like dozens of things that could go wrong with your brain's dopamine system. Either naturally, you're genetically untalented, as it were, or predisposed. And it would, for example, the brain's dopamine receptor sites could be poorly functioning. So if you imagine dopamine is manufactured right at the base of the brain, at a part of the brain called the VTA, the ventral tegmental area, and little dopamine molecules are shot up to a part of the midbrain called the nucleus accumbens. Now, whenever dopamine molecules hit the wall of the nucleus accumbens, you'll feel reward or motivation or those kinds of feelings that dopamine is designed to control or make you feel. So now imagine the little receptor sites that suck in the dopamine molecules are few and far between, or they're stuck, or they don't work properly, or other issues to do with that. Well, then you would wind up feeling chronically unrewarded or unmotivated or lacking in meaning, right? Now, if you look at research groups like National Institute on Drug Abuse, they will describe addiction as a predominantly adolescent illness. They call it that, an adolescent illness. What that means is that the onset of addiction is almost always in adolescence or early adulthood. And if you think about the people you know who are addicted, that's true, right? There are exceptions. There's late onset addiction, usually as the result of a discrete event, usually a traumatic event, quite often PTSD. But most addicted people will have gotten going with their addiction in their teens or early 20s. Now, if you think about it, what's going on in your teens? You are becoming more independent and you're able to go out into the environment and find dopamine agonists, things that upregulate your brain dopamine. And those things, for the most part, would be drugs of abuse: marijuana, alcohol, solvents, amphetamines, cocaine. These days, increasingly kids are using cocaine and ketamine and things much earlier. I would say the illness itself started long before that. It's just that in your teens, you acquired the independence and the ability to move around in the environment and find things that would medicate your underlying illness, which is one of poor dopamine function, or feeling very ill at ease in your own skin, very unmotivated, very unrewarded by things that other people apparently find very rewarding. And you take cannabis or alcohol or such a drug for the first time and it fixes you. So it won't so much get you high. If you're a dopamine deficient, reward deficient person by nature, when you discover something that strongly upregulates brain dopamine, suddenly it will feel like a revelation. You know, it will be almost a spiritual experience. Other people might be getting dysphoric from that first joint. It might make them feel quite sick because they've already got very good quality dopamine function. So taking such a big spike of more brain dopamine in won't make them feel that well. They won't like it. But for you, it won't probably even get you high. It will just get you normal. So you will be where everybody else already is. Okay, so when that happens, that is a major event. It does several things, arguably. This is how the theory goes. Your brain's memory systems, which are also strongly a part of the overall dopamine network, they will get involved. And because dopamine is strongly involved in creating new memories, it like literally bathes brain circuits that are involved in new behaviors when they're considered important enough to be prioritized. And your brain's pretty clever. It's trying to reach homeostasis. It's trying to reach balance. It's trying to keep you alive. And you have been going along feeling quite sick, feeling not very well, not very able to function. And now this medicine has made its appearance on the scene, your brain's memory and learning systems are not going to let you forget that, and they are going to strongly prioritize that drug in the future because it made you feel well. And in addition, probably send messages and signals up to the front of the brain, to the prefrontal cortex, that's involved in things like decision making and impulse control. So whereas the frontal cortex would usually, is like I suppose the common analogy is the brain's CEO. So it's making decisions that it considers in your best interests, involves and controls safety and things like that. Whereas usually you might consider this an unsafe behavior. You know, don't take heroin, your parents wouldn't like it. It also controls sort of social identity and conformity and things like that. So whereas usually it would disavow this kind of behavior in the same way it would jumping off a cliff, in this particular context, because you've been so unwell, the message is you can make an exception for this behavior because it's so useful. And further, you should identify strongly with anyone and anything that can provide you with this drug. So there you have a start of an explanation around what's going on with impulse control and addiction, why addicts continue to do stupid things when they're clearly not stupid people. Okay, that aspect of addiction that really confounds relatives and friends. They can't work out why their loved one is continuing to do this dysfunctional behavior. So decision making and impulse control is kind of the last bit of the illness to take effect. It kind of turns you out, as it were, and really exposes you to bad consequences because you're prioritizing the drug over common sense. And famously, addicted people are able to be sensible in many other areas of their life. So being able to run a company or do this or do that does not negate you as a potential addict. It does not prove that you're not an addict. The lack of impulse control, the lack of reasoning faculties can be quite specific to just the drug or the addiction, okay? So that's how it works. It's like an overall brain dysfunction, if you like, going from the very oldest bits of the brain, right at the hindbrain, right to the front, the most recently evolved human brain areas. Okay, and people think, well, why can't willpower triumph over that sort of animalistic wanting? Well, that's really obvious because the older parts of the brain in the hindbrain and so on are much better wired in. They've been around for a lot longer. They're hundreds of millions of years old. I mean, thank God they're not easily rewired. You need to jump out of the way of danger when you see it. You need to eat when you're hungry. You need to breathe when you're asleep. And those very old reptilian brain areas that are involved in the manufacture of dopamine and the more animalistic elements of the addiction, you know, the wanting and the getting, that is very strongly wired in for good reason because it helps to keep us alive. It's just that in this case, it's kind of being turned against you. And conversely, the prefrontal cortex, the very human elements of the front of the brain are very recently evolved and they're very poorly wired in and they're very weak. And if it comes down to a fight between your reptilian brain and your human brain, well, your human brain will lose that one. Right? So that in a nutshell really is what addiction is. And it used to be called the stop-go system for that reason, or the stop-go theory of addiction, or the hijack brain theory of addiction, which is very, very unfashionable now. But in my view, quite on point. So now let's imagine that you've had your first using experience. It was revelatory to you because you were dopamine challenged. Okay, biologically. Now there are other ways they claim that dopamine anatomy could be damaged. It could potentially be damaged by a consistently unrewarding and nasty environment. So there is some talk about the idea that those sorts of things can damage what they call hedonic tone, or your ability to feel pleasure. I'm not sure about that. The third, but it might be true. The third one would be more obvious, which is drugs. The drug abuse itself will cause what's called dopamine blunting. So you can see this even in an ordinary person who's not addicted. Just go and watch lots of YouTube videos, lots of YouTube shorts, and watch them for an entire day, for 8 hours. Because of the exciting nature, perhaps humorous, sexual, violent nature of some of those clips that you're watching, it will flood your midbrain with dopamine tone because it's exciting and thrilling and rewarding. And at the end of it, you will feel completely empty and you won't want to watch any more YouTube videos. That's because your midbrain dopamine function has become blunted. So we'd refer to that as dopamine blunting. So obviously, the more you abuse highly dopaminergic things, the more it will splurge dopamine. And actually what happens, they reckon, is that your dopamine receptor sites kind of get tired of the noise. It's too big a signal. So they kind of turn the volume down. So especially when you're talking about drugs like methamphetamine or cocaine that really massively spike dopamine function, obviously that's too much for the nucleus accumbens, and the receptor sites on it will eventually die off because the signal is too loud. And so now you're in a chronic downward spiral of dopamine blunting. There you were, needing more dopamine agonists, things that upregulate a neurotransmitter. And you found them. They were called drugs, whichever drug you chose, and you used it. Now, at the beginning, that will feel amazing, but pretty quickly, you won't get as high, famously, right? And when you come down, you'll go lower. Well, that is directly, as I was taught, what's happening with your dopamine function. Each successive use of the drug will not take you as high, but it will take you lower. And so there you were, biologically predisposed to need something that upregulated brain dopamine. And then when you found it and started using it, you would overuse it and cause further dopamine blunting. So that, in a nutshell, is the dopamine deficiency model of addiction. It doesn't explain everything, but when I outline that to people in treatment, I get a lot of nodding heads, and particularly this bit, the idea that it existed, this condition, before, during, and after active drug use. So in other words, the illness is not about the drugs. And it can't be, because we know that there are many addictions that don't involve drugs. Okay? So gambling does not involve drugs, and yet when you stop, you will undergo some kind of withdrawal. It's not a physical withdrawal. There's nothing happening really to your nervous system. You won't start shaking and sweating like an alcoholic would. But clearly, you are in a psychologically distressed state. That is to do with dopamine, not anything else. So physical dependence is not a common denominator in addiction. Some addictions cause physical dependence, some don't. Therefore, being physically dependent on a drug is not what we're looking for. What we're looking for is cravings. So here is a nasty analogy that I will use to drive this home. So let's say I kidnap you and your friend and take you to my cellar and tie you both up and inject you forcibly with heroin, high-grade heroin. You have a history of addiction, he does not, but you're currently sober. You've been sober for a year. So you're both coming from the same baseline, but you have a history of addiction, he does not. So I inject you both with high-grade heroin. What's going to happen? Well, obviously, within a week or so, you will both be dependent on opioids, right? So now I release you. And you run away, obviously. Maybe you go to the police station to report me. And there you are. Your friend is giving a description. He's making a statement. He's in withdrawal, just like you are. He wants to get to the hospital to get some methadone or Suboxone to make the come down, the taper more bearable. He wants to do that just as much as you do, but he's taking his time and he's giving the police a statement. And next, he's just going to proceed to the hospital, get some opioid replacements and get himself tapered off of opioids. And he'll probably never even smoke a joint again because the whole experience was so traumatic. You, however, are having second thoughts. You make your excuses, you go to the bathroom, you escape through the window and you run back to my house. And you say, could I have some more heroin, please? That's the sort of thing that addicts do. And it's not because they're physically dependent. You were both physically dependent on heroin at that time. You, however, were having strange mental phenomena called cravings. That's pictorial. It builds images in your brain. It creates specific emotions, wanting emotions. Cravings is the common denominator in an addiction, not physical dependence. There are people out there today who are physically dependent on a drug, but they're not addicts, and vice versa. So out there today, there's an old person who just had a hip operation and they're physically dependent on morphine because that's what they were put on while they were in the hospital. They'll get off that and they'll be fine. But somebody who's addicted could engage a behavior that doesn't even involve a drug, like sex or gambling, and become horrendously addicted. So psychological cravings are the hallmark of addiction, not necessarily physical dependence. So now if you think about it, most of the people that I talk to about this, they say, yes, I did not feel the full packet as a child and a teenager. Now I know a lot of people are going to say that, but the thing is, they will describe the same kinds of feelings, those same kinds of unrewarded symptoms. Mind-crushing, evil levels of boredom is one of the big ones. Boredom that other people don't seem to suffer from. Restlessness, irritability and discontentedness, that's a kind of existential angst. These are distinct symptoms. They're not quite the same as depression or anxiety or ADHD. Then they find a drug and it makes them feel better. It just solves all of that. It's a panacea. So of course, they prioritize its use. Then the use of that drug becomes so problematic. It is a medicine, but it's just a terrible medicine. The side effects are just dreadful. The side effects might even kill you. So you decide that that medicine you can't carry on using it. So you stop. And then much to your surprise, you feel ill again. And you can't work out why, because you're not using the drug anymore. Well, that's because the symptoms of the illness have returned, because it was a primary illness. Right, so here's the good news bit. So that's all pretty negative, but here's the good news bit. Like other chronic illnesses, the treatment for addiction is there. It's very clear. It's mostly behavioral. It will be, no doubt, we'll prove at some later point, it will include things that naturally upregulate midbrain dopamine function because they're rewarding in a slow-acting, slow-release, long-acting kind of way. That's how I describe it. What you're looking for in recovery from addiction really is slow-release, long-acting dopamine reinforcers or dopamine agonists, things that raise your reward, meaning, purpose, feelings naturally. And for some reason that we still don't really understand, those things seem to be altruistic acts, community, tribe, belonging, not being isolated, doing esteemable things and being seen to do esteemable things, but most importantly, knowing that you're doing esteemable things. Now, why these things raise midbrain dopamine function, aka create feelings of recovery and serenity and peacefulness, I have no idea, and I don't suppose anybody else does either. But my guess is that those things that are common in things like 12-step fellowships, or even, it might be said, in things like monasteries or temples, where some people go and successfully recover. But if you're not going to become a monk, most likely you're going to go in the direction of a 12-step fellowship or something like that. And those places are effective treatments for addiction because they provide those things that are natural dopamine upregulators. So what you're not looking for is anything that is nasty and spiky and short-acting, quick release dopamine. You are not looking for that. All of those things will make your recovery more difficult. And of course, those are the things we reach for first when we become abstinent and sober from our drug of choice. You stop using heroin, cocaine, ketamine, marijuana, alcohol. You start reaching for cigarettes, coffee, carbohydrates, sex, relationships, validation. We know why now, because all of these things are natural primate needs that obviously have a long, long history of upregulating brain reward. Right? So you need to kind of skirt around that if you can and find the more acquired tastes that will raise midbrain dopamine. So that's how treatment happens. If you do those things very regularly, daily, then you will put the symptoms into remission. And over time, that will become so natural that you have, to all intents and purposes, cured yourself. But don't forget the reason why we need to abstain. The reason why we need to abstain, whereas other people who don't have this disability, they don't need to abstain. They can manage their drug use. We can't. There are heavy memory and learning components of this illness. Okay, the brain's memory system is the implicit memory system is kind of a stacking system or a filing system, really. You're not really, as I understand it at least, you're not going to really get rid of memories unless you have electroshock therapy, and you don't want that, right? So all memories really are available for recall under the right circumstances, and stacked very high near the top will be the memory and the learning, indeed, of drugs fix me. So, and of course, as soon as you engage them, all bets are off, because it triggers that whole beast again. That whole reptilian beast is going round again, and then it disorders your frontal lobe impulse control, and you're gone. So that's why NIDA, the National Institute on Drug Abuse, refer to addiction also as a frontal lobe pathology. It is an impulse control disorder of a kind, right? So don't forget, that's why you're different, and that's why you need to abstain.